let's get into it. Today, we're talking about something you might not think about, how being underweight, and I mean for any reason, can seriously mess with your skeleton. We're going to look at what happens when your own body decides to put your bones on a very strict and very dangerous budget. So this sounds a bit like a riddle, right? A tiny, premature baby and a super fit young marathon runner. What could they possibly have in common? Well, as the research shows, the answer is this kind of hidden vulnerability deep inside their bones. So let's unpack exactly what's going on here.
And to solve this riddle, we really need to get our heads around one single core idea. It's this concept we're calling bones on a budget.
Okay, so at the absolute center of this whole story is a state called negative energy balance. Now, that's just the clinical way of saying something really simple. Your body is not getting enough fuel, enough calories, to cover its most basic daily operating costs. It's running at a deficit.
Here's the best way to think about it. Imagine your own household budget suddenly goes into crisis mode. What do you cut first? You're not going to stop paying for the lights or for food, right? No way. You're going to put off the big, long-term projects like renovating the kitchen. Well, your body does the exact same thing. Building and maintaining bone, that's the kitchen renovation. It's super important long-term, but when it's a question of pure survival, that project gets put on hold.
And you know, the reasons for this energy crisis are way broader than you might think. The research shows it can be triggered by a whole range of things. Chronic illnesses like Crohn's disease that mess with nutrient absorption, the huge energy demands of something like cancer treatment, and of course, psychiatric conditions like anorexia. And here's the key thing to get. Your body really doesn't care why it's short on cash. It just reacts the same way every time. So let's see how this budget crisis actually plays out in the real world. We're going to start at the very, very beginning of life with our first case study.
You know, building a skeleton in the womb is basically a race against time. This timeline shows that even though the basic frame is laid down pretty early on, the real strengthening, the fortification, happens right at the end. I mean, look at this. The amount of calcium transferred from mother to baby goes from about 60 milligrams a day at 24 weeks, and then it just skyrockets to nearly 350 milligrams a day around week 35. That final trimester, that's the make-or-break window for building strong bones.
So what happens if a baby doesn't get to finish that race? A case study from the research gives us a pretty chilling answer. A baby is born 14 weeks early, at just 26 weeks, and very soon after birth, the doctors find multiple fractures in the baby's ribs. Now, there was no family history of bone disease, so the cause was clear. This wasn't genetic. It was a direct result of that timeline being cut short.
The official diagnosis for this is metabolic bone disease of prematurity, or MBDP. What that really means is, because the baby missed out on that massive last-minute flood of calcium and phosphorus from the mother, its skeleton is left soft, demineralized, and just incredibly fragile. And this isn't just some random tragic event. The research has actually identified really clear risk factors. Prematurity is, of course, number one, for the exact reason we just talked about. But you can also see things like low birth weight and needing IV nutrition, which can make it harder to get those minerals in. It all just points back to one thing, a failure to complete that critical construction project in the womb.
Okay, so that's what can happen at birth. Now let's jump way forward in the timeline and see how this very same principle, this bones on a budget idea, affects young adults. Let's look at the athlete's story.
So our next case is a 30-year-old woman. She's a serious runner, clocking 42 miles a week. I mean, on the surface, she looks like a pillar of health until a stress fracture just completely stops her in her tracks. But the big clue is right there in her vitals, a BMI of 16.6, which is seriously underweight. Her body, just like that tiny premature infant's, is deep in a state of negative energy balance.
And here's why this is so unbelievably critical in your teens and 20s. This is the one time in your life when you're supposed to be building what's called your peak bone mass. The best way to think of it is like a bone 401k. You make your biggest deposits right now to build up this strong reserve that you have to draw on for the rest of your life. But undernutrition completely hijacks this process. It shuts down the key hormones like estrogen that are essential for bone building. So you end up with a much, much smaller retirement fund, which leaves you vulnerable to fractures for decades.
And the sheer scale of this problem, it's just staggering.
The research shows that for women with anorexia nervosa, having low bone density isn't just a possible side effect, it's pretty much a guarantee. More than 85% of them are affected.
So, this leads to a pretty logical question, right? If low estrogen is a huge part of the problem, can't we just, replace it with something common like a birth control pill? It's a strategy doctors often use, but is it actually the right one?
Well, the research on this is really clear. The common approach, giving oral contraceptive pills, is actually ineffective at rebuilding bone mass in these women. A much more effective strategy is using transdermal estradiol. That's an estrogen patch. It delivers the hormone in a way that better mimics how the body would naturally do it. It's such a crucial difference, and it really shows why specific, evidence-based care is so important.
All right, let's look at one final case. This one is really interesting because it shows just how complex and sometimes overlooked these issues can be.
So our final case is a 26-year-old woman. She's also underweight, also has bone problems. But her story is totally different. She doesn't have a distorted image of her body. She just reports a long history of having absolutely no interest in food.
This actually points to a completely different condition called avoidant/restrictive food intake disorder, or ARFID. Now, the end result for the body, that severe undernutrition and its effect on the bones, is exactly the same as anorexia. But the reason why it's happening is completely different.
With ARFID, the person isn't eating because of things like a profound, deep-seated lack of appetite, or maybe an intense fear of choking, or even just a powerful aversion to the sensory experience of food, the texture, the smell, the taste.
And here is the absolute critical distinction. Unlike anorexia, ARFID has nothing to do with a fear of gaining weight or being distressed about body shape. For the skeleton, yeah, the outcome is the same, but for diagnosis and for treatment, understanding this different root cause is everything.
So, after this whole journey from the womb all the way to adulthood, what are the most important things to take away from all this?
Okay, so let's just recap the big points. First, we've seen that for your bones, being underweight is a huge red flag, no matter what's causing it. Second, your body is a survival machine. It will always sacrifice a long-term project like bone health to deal with a short-term crisis. Third, we saw how premature birth literally robs a newborn of that one critical window to build strength. We also learned that for a condition like anorexia, the common go-to treatment like birth control pills, it just doesn't work for rebuilding bone. And finally, with ARFD, we're reminded that the reasons behind that energy crisis can be incredibly complex and often hidden in plain sight.
And all of that leaves us with one last question. From the tiny, unseen fractures in a newborn to a painful stress fracture in a runner, our bodies are constantly sending signals when that internal budget is in the red. These aren't just one-off injuries. They're symptoms of a much bigger systemic crisis. So the real question is, are we listening closely enough to what our bones are desperately trying to tell us?